Hi, everyone. We'll go ahead and get started here. Thank you, everyone, for joining. My name is Vishakha Sant. I'm the Global Head of Healthcare here at ServiceNow. A little bit of background around me. I've been with ServiceNow for about a year and a half now, really looking at where do we take the healthcare solutions in the space. Prior to that, I was with Kaiser Permanente, where I led various digital healthcare transformation initiatives for them, where we looked at clinical engagement, patient access, and just how do we enable better healthcare and outcomes from a patient and a provider perspective. And so thank you all for joining me today. Just a couple of just housekeeping. I'll be making some forward-looking statements here. So, please reach out to the account teams in terms of what's there today versus what's more road mapping. But my goal really is to provide an overview as to what ServiceNow is doing in the healthcare space. And in part, I think it's helpful for us to all understand that, this quote really hits home in terms of it's not the strongest of species that survives, nor the most intelligent, but it's the one that's most responsive to change. And I think we all, as healthcare practitioners that are looking at providing better patient outcomes, that are looking at how do we optimize and really help some of this healthcare burden that's being placed on our clinicians and our general practitioners, how do we help? And COVID has really made us test this notion of being adaptable and responsive to change. And I think it's very clear that, the pace of change in healthcare is the fastest that it's ever been, but yet it's the slowest it will ever be. As you see, virtual health has an uptick in adoption during COVID, then it kind of went back down, but the levels are still higher than they ever were before, right? We're still seeing on average 50, 60% of telehealth adoption, and pre-COVID, it was more like around 12 to 14%. And so adaptability is this notion, what is driving a lot of the healthcare strategy that we have here at ServiceNow. And it's really key for us to really think about, what are some of the factors and the imperatives that you all are facing in the industry as well? Staff shortages and burnout, the great resignation, it's very real, right? I'll share a little bit of a personal story. My husband was in the hospital the last 5 days. He just got discharged over the weekend. And I, as an observer of the care being provided, saw that there's so much burden placed on these clinicians. There's a lot of tasks that they don't necessarily need to do because we can actually automate some of that. Integration of all the different health services, right? The virtual care infrastructure, the EMRs that have to come together. How do we actually bring that into a platform that allows for the ability to have data fluidity, to get the information, and then more importantly, take action to do something, to close out a request that has been made. You see a prevalent of, mergers and acquisitions happening in the space right now. A couple of months ago, I went to a virtual health conference, and the proliferation of digital startup vendors, it's huge right now. Healthcare is digital health is the biggest investment for these investors right now. And then we have, the consumerization of healthcare. So really the ability for patients to want to have a better experience. We don't want healthcare to happen to us. Healthcare happened to my husband, right? There was very little choice that we had in terms of what was happening. But in those areas where there are choices, wouldn't it be great for you as practitioners to be able to know that patient, so you're not having to ask them 5 or 6 different times through shift changes, what's going on with you? Wouldn't it be great for them to really understand that my healthcare system knows me and they show me that they know me, and now they can take better care of me? And so I think it's important for us to just point out, what do I feel like the healthcare looks like in the future? And a lot of it is going to be healthcare without walls. There's more people right now that need care. There's more devices across the infrastructure. There's more people in different locations that are actually providing that care. And the locations have changed, right? Now, a lot of these healthcare organizations and hospital systems, the ones that are being more innovative, truly see that hospitals are going to be very specialized in taking care of the sickest patients. A lot of primary care is going to actually get back into the home and have, clinicians and the equipment and the testing that's necessary to help support the infrastructure so that Studies have shown, patient care at home actually leads to better outcomes. And so a lot of it is going to change, as well as the notion of regulations are also going to help support that. And this notion of, having more care at home for elderly, for social care as well. So with that, I want to introduce this concept of healthcare workflows. And I think it's important for us to all level set on, what do I mean by workflows? It's anytime we ask a person, a device, or a system to do something, to bring information, there's a series of linkages and dependencies that have to happen across the healthcare ecosystem. And then there's a series of activities, whether they're sequential or parallel, but really, how do you actually get the work done? So that you have this notion of a requester, and then you have at the end a fulfiller or a fulfillment of that request. And everything in between that is what I'm going to be talking about, which is the workflow. And for ServiceNow, we've been doing this, right? So as you look at this slide, here's how we actually look at the different workflows for healthcare providers. When you go from left to right, it really starts with the consumer, right? So what is that patient engagement? How do we actually provide a consumer grade experience for the patients that then can take it back into the clinicians that are supporting them? Then you have this whole notion of, the risk and compliance. Data breaches are at the all-time high when COVID was, at its peak. A lot of, cybersecurity threats. That's still a key area for hospitals. Uptime, business continuity is a must, right? Then this whole notion of employee workflows. How do you actually make it easier to do the work from a clinician and administrator standpoint? And then lastly, you have the IT and shared services workflows. That's essentially where ServiceNow, that was our bread and butter. We have very much looked at, branching out into this notion of healthcare data model, having much more relevance in the healthcare industry. And we've had successes with partners like New South Wales that are leveraging us for their, patient check-in experience or their patient-related outcome measures. NHS Scotland that use ServiceNow to vaccinate their population across all of their various citizens. And so you'll see some of the use cases throughout this presentation, but what I really want to do is introduce and make you aware of the digital health platform that ServiceNow has. And again, I think it's important for us to all level set on what do I mean and how is it being defined. So Gartner is a syndicated research firm. We align ourselves with the definition that they have as well, which is one, it is a set of industry-specific data model and data connectors. So how do you actually have the data objects that link into other systems that are clinical? Then you have this notion of pre-built business capabilities. So 80% out of the box capabilities that help you run with, getting pre-visit management, or I'll talk through some of the workflows. And then the third component is, how do you go build your own to satisfy the needs and challenges that you have at your healthcare organizations? And so with this digital health platform, what it's allowing us to do is expanding our reach. We are no longer just focused in on the hospitals internally. There's a whole ecosystem that happens in healthcare. You have the clinicians that are providing the care. You have the caregivers that are caring for the patients that are not necessarily clinicians. They could be family members. They could be, other people that are within the ecosystem that have something to do with the patient outcomes. You have this notion of the academic institutions, which have the research or have the, programs that are actually pumping out the clinicians into the ecosystem. How are all of these things interrelated and connected? Healthcare is truly broken. There is challenges and gaps along the way from when a person signs up for, choosing a hospital institution to being triaged, to being discharged, and now care is at the home. It is not a smooth process. And so all of it could be resolved with various workflows. And that's what I'm here to talk to you about. This is our platform stack. What we're really looking at is at the base layer, we have, ITSM, and then on top of it, which is IT service management. So that's, again, what ServiceNow has been known for, which is incident response, right? I have an issue with my laptop. I need it to be fixed. You put in a ticket, something happens, somebody comes and fixes it, or you get sent a new one. But now we've actually extended that data model into leveraging our customer workflows so that we're now able to actually do cases instead of incidents that are related to potentially patients and different locations outside of your hospital organization. So to your affiliates, to the agencies that you might be working with. And we do that because we have this notion of a healthcare data model, which is built on the HL7 FHIR standards. It's an international standard. And then we're able to have components like Patient 360, so a full view of that patient, and you'll see here in a second what that looks like. Components like consent management, we've all signed them, right? The consent forms, the ability to actually either give them to somebody who then has to PDF it and scan it into a chart, or digital documentation, the forms themselves. How are you signing those? So many times during this experience we just had, I had to fill in a paper form and I asked them, what do you do with this? Oh, well, there's somebody that actually now types all this information in. And I was like, this is, that's so silly, right? If you think about, we're in a digital era and now we're wasting 10 minutes of somebody's time to document, and it's just redundant. So, and then we have this whole notion of the patient portal. So how do you access from a patient standpoint all the information? And literally, care shouldn't stop once there's discharge. There's digital engagement that should happen. And studies have said that if you digitally enable someone to your organization, they're 3 times as likely to stick with your organization instead of, go somewhere else. And then on top of that, in this white layer up here, we have the various pre-built workflows. So we spoke about vaccine administration management, the ability to actually have patients schedule appointments to get vaccinated. Pre-visit management is the whole journey around what's the pre-visit process before you appear for a procedure. Have you signed your consent? Do you have your documentation associated with it? Do you know what's expected of you? Sometimes patients are, not informed. And sometimes if it's a referral, PCPs aren't, or general practitioners aren't informed as to what happened once the care was referred out. Patient support services, the ability to streamline enrollment into different drug therapies, and this whole notion of creator workflows, which allows you to go build your own based on the challenges. And while it's not about these specific workflows, there's components of these workflows that can be adapted to any workflow that you might have that require scheduling, for instance. How do you schedule patients at home? Well, we've built the components for it. You'd be able to leverage that outside into a workflow that's more meaningful. And so at a high level, what this allows is, we spoke about that ecosystem. Anywhere in this ecosystem for healthcare to work, people will have information that's requested. So in this, you have the ability to actually search for information. You have the ability to create a unique case ID, and then you can actually get the various aspects of our platform. So our virtual agents, or our ability to workflow it to a warm body so that they can have the information. And then it goes behind the scenes to the appropriate business functions like IT, or perhaps it's going to, the business functions for a billing question. And at the end of it, we're trying to give time back. And the only way to do that is be able to leverage these digital levers, which is, improve the engagement, reduce the operational efficiencies, reduce some of the costs through taking out the redundancy that we have in healthcare. And so, going back to now some of the integrations associated with it. So you have all of the information that's sitting in these various ecosystem players, right? In your hospitals, in your agencies, your affiliates, et cetera. And then we have this notion of automation engine, which is basically, ServiceNow acquired IntelliBot 2 years ago. We rebuilt them into our platform. They're an RPA company. And so the ability to do robotic process automation for things like claims processing or scheduling appointments, if it's like bulk appointments, and married with our integration hub, which already has various spokes, which is essentially like, connections to these different systems or different tools like DocuSign for consent, or, Adobe for forms. And then you have this notion of getting those spokes and the interfaces associated with it. So we're leveraging Redox. Redox essentially allows us to have connections to 85 different EMRs, 300 different other clinical systems. And again, because of the industry data model, we can now connect with the Epic, Cerners, Workdays of the world so that you can get to a point of holistic workflow automation and really think about, how do you innovate in the stage, or how do you maintain a better workflow with your existing operations? And so, this is a part of the industry data model. I know it's a little bit hard to see, but essentially, I wanted to point out that, it goes into the practitioner, it goes into various locations. And so why this is so important with the digital health platform is it's not the platform, it's what it's allowing you to do. So traditionally with ITSM, you had the ability for you to have, a case or an incident that was created, but now you can actually take that incident. So my laptop, my location, something went wrong with it. And now with the digital health platform, you could be a nurse that's charting in a patient room and you see that maybe a pump is, not acting right. You can log a case against that pump. And as shift changes, the next person can actually see what's happening. Oh, and if that is in a different location, you would still be able to follow up on it. So now you get to this notion of like enterprise shared services. Think about if you're a healthcare system that has 14 different locations, how are you able to manage all of the cases across those locations? How are you able to manage, patients that might have billing questions across those locations, and maybe you're not able to have the visibility into processes that might not be working that allow for a better experience for that patient. And so this is where the digital health platform actually comes into play and allows you the visibility across devices, across locations, and across institutions. And so traditionally, if you've worked with ServiceNow, we've had this base capability, right? We have our IT workflows, the employee workflows. You can see all the various kind of traditional workflows we had. And now with the digital health platform, you see it's very healthcare centric. So from a patient standpoint, we have these various workflows that look at accessing. How do you actually improve access in the rural areas? If you have a virtual health platform, is there a way that we can augment some of the experiences that they might have to increase the access and health equity? We look at patient engagement, right? How can the digital experience be an extension of your healthcare system? How do we engage in certain areas? If there's a chronic condition, are there alerts? Are there messages? Is there programs that your healthcare system is employing? And then how can we actually enable it from a digital perspective? The ability to actually get the care that's needed and show that information up. Or from a clinician standpoint, how are you able to really look at when there's issues with the EMR, where did those issues go? And so we're really able to take this information, make it more healthcare centric because of our digital health platform. I spoke about the spokes earlier. You can see here in this middle layer, in the white layer, various, either spokes or interfaces that we have that can, and these are just a few of the hundreds that we have, but they really will help you bridge some of the data gaps that are existing today that disable the workflows from working accurately. And that's really what we want to do is, again, enable the integration of workflows so that we can all get to a point where work is happening better and actually, overall reducing the cost of care. So here's a little bit around our existing solutions. I want to point this one out, clinician onboarding. When you have residents or new clinicians that are coming to your institution, how are they onboarded? What experience do they have, right? Are they getting a good experience? Are they getting in front of a patient as soon as possible so that you're not wasting the time and effort of just the whole process of onboarding? So we've built this capability that allows you to essentially, either desktop or mobile app, go in, imagine I'm Dr. Amy Brooks right now. I have a mobile experience. I can log in and see, oh, okay, like here's the pre-hire checklist for me. Here's all the different things that I need to do associated with it. Here's my healthcare team members. And then, oh, sorry, something didn't work out right. But essentially it goes through and it takes them through a list of different tasks and different solution or next steps that are required for that clinician to be successful. And so I'm not sure what happened to the button, but essentially it goes through and says, here's your healthcare team members, and then you can get on to the next step, which is I have to sign a consent form or the NDA agreement. It gives you the spokes for the NDA agreement associated with it. It also can then takes you through a licensing and validation of the license process. And again, these are those things where it could be all over the place right now. Your institutions might not have it all worked out, but we have been able to see success with this in other healthcare organizations where we're able to, SCL Health leveraged us. They were able to reduce the average advanced practitioner onboarding by 30%. They're able to actually get the turnaround time for provider credentialing by 50%. And then more than anything, they're able to consolidate these different systems that we have our administrators and our clinicians access for onboarding into one streamlined portal so that they can actually, have one place to go, and all of what's happening behind the scenes is much more of a workflow. Then we have another one, which is around EMR help, right? So this really is around, I saw so much charting that was happening in my experience just last week. They're always charting in the health record, right? For the patient, they're asking questions, they're charting. Now, if something happens and there's an issue related to that record, what happens? They're so busy. I mean, imagine again, the burden placed on them to have to go report it somewhere and then to follow up on it. This solution actually allows for a widget to be placed. This is my chart, for example, an Epic hyperspace screen, where you can actually click on the widget right from where they're charting, and you can see it pulls in the encounter information, the IP information, all of the user information. Isn't that great for your IT teams to be able to get that information associated with somebody's record? And this can actually go on to saying, hey, there was a problem with this chart, or hey, I need lisinopril 5 milligrams added to the dropdown. It gets routed to the people that actually do the configuration of your EMR. It starts a incident and then it goes on its way to actually getting resolved, all from a workflow that's not taking them out of their current state of documentation. Again, it's saving times and having that visibility. We've had some outcomes here, University of Kentucky. You could see that, they were able to reduce the cases that were managed and get to a point of really getting, first call resolutions because they have more of this information ahead of time. So now I want to talk a little bit about the pre-built capabilities associated with the digital health platform. I spoke to you about this notion of patient 360, and it literally is that a holistic view of that patient. Now, in the States here, we have private insurance, et cetera. So the ability to actually imagine I'm a patient services rep or somebody that's dealing with that patient. How can I get a full view? So we're able to pull in their insurance information, perhaps the last different interactions that they've had with the payment. If there's some bills that are outstanding, we might be able to pull that information in so that your patient services administrators have a full view on what's happening with that patient. You could see up here, we're pulling in information from the conditions or the medications that would be coming in from the electronic medical record. We could look at the different things that the patient might have called about previously, various cases or interactions that they might have had with your healthcare organization. And again, this is not just one location. This is across your healthcare institution. This could be across the affiliates that you might be working with, contracted or non-contracted, or whoever you refer out to. You would be able to get that information back in as well. Consent management. I spoke to you a little about this notion of it's a headache sometimes, right? Continuously filling out forms, signing the consent, scanning it, storing it somewhere, then the form has changed. I mean, it's arduous and it doesn't need to be. I mean, we're in this day and age, we should have the capability to have digital consent. And so as your kids go back to school or go back to, I'm sorry, like summer programs, right? The ability to show vaccination status, somebody has to authorize that. That could be a digital workflow, right? And we shouldn't have to place the burden on the clinicians to do this manually. It really should trigger. So a patient can sign a consent. It could trigger a workflow to then, sign, have a clinician authorize it. So this is just beyond consent management. Again, that spoke could be anywhere, in any type of form. And speaking of forms, this is the digital documentation, right? So the ability to actually create forms. I know that one of the challenges I had in my previous institution is we were spread across the US, right? And so across state lines, we can't have the same form because legally things are different. And that variation was a nuance, right? And so you have to allow, while standardization is great and enterprise standardization is even better, it's hard to get there locally, right? And so the ability and flexibility to create your forms, to have that kind of regional variation while still being able to have it digital and automate some of the workflows that might be triggered off of it as well. And then this is our whole notion of patient portals. So think about this in the use case of, and many organizations have portals right now, right? But then also many organizations have multiple EMRs. And so they might have different flavors of an experience for a patient, or they might want to get into, let's say, diabetes management program. And for whatever reason, their portal might not be conducive to having a whole layout for that type of patient, right? So we could potentially hook into either create a standard enterprise experience. So one flavor, and that's what we're doing with one of our customers, is trying to be the face of all of their various hospitals that have different EMRs for a digital engagement for the patient. And at the flip side, if there's certain portals that you have, but then you need a unique experience for, let's say, some sort of a condition program that you're running, then we'd be able to then, link into that portal, but essentially gives you a way to have the bots, the analytics, the knowledge, all of the information related to how a patient is engaging with your organization. Some of the pre-built workflows, I talked a little bit about the vaccine administration management. Again, the ability for people to, and this is beyond COVID, right? This is just immunizations in general. How can you actually track those at scale? Yes, EMRs do that as well, but not everyone has the same EMR. So it's not always a great experience for the patients that are trying to get this information. Pre-visit management, again, this is the notion of making sure that you have a series of tasks in order for these patients to be accessible, to be able to go through your healthcare system and do it in a way that makes sense. So here, imagine this is a colonoscopy procedure. There's an intake form that has to be completed. There's some validation of, is that order accurate? There's some to-dos that a patient has to do, as well as, information that a patient services rep needs to be able to authorize and kick off. Then somebody needs to schedule the procedure. So all of those things right now are not necessarily an automated workflow. I mean, think about it, it's just like a GPS that allows for you to automate the checkboxes that we currently have in spreadsheets or on boards, or, just like knowledge of how things are done, but the ability to now actually create this notion of what we call a playbook. And this playbook could be for anything. In this use case, it's for pre-registration, but it could be used for any types of challenges that you might have. So A, it guides that patient services rep, and B, behind the scenes through the patient portal or any portal that you might have, it guides the actual patient as well. Then we have this notion of enterprise access patient support services, which essentially allow for patients that are looking at various drug therapies to have a better enrollment experience. So if you have a academic institution that's looking at doing studies or clinical trials, how do you actually marry and be kind of the match.com to say, it's this criteria I'm looking for, patients meet this criteria, let's move on into an enrollment process, and how do we actually make it a better experience for that patient? And then more importantly, how are we able to now look at outcomes based on, the engagement that we consistently have with that patient? And then this one is, really around enterprise asset and medical device management. I always ask this question, and I always get met with, we don't, which is, how are you able to manage all of your clinical assets across your facilities now? Do you have a way to do that? So ServiceNow has always been in the business of doing IT asset management, which means, cell phone, laptop, we've always done that. We are now extending that into clinical assets. So your defibrillators, MRI machines, you name it, whether they're connected or not connected, we would have the ability to actually manage the life cycle of that asset. So that means everything from, procuring that asset to inventorying it, to deploying it, and then more importantly, servicing it, right? And so for the ability to maximize the return on investment, you have to service these assets and document those things. And then at the time of decommissioning, are you wiping that asset? And do you have all of the information, cleared and all the steps documented? So what we're really doing is looking at this notion of medical device management, again, not just to one location, it could be across your whole health system, and even in the homes of patients where you might have devices for remote patient monitoring, right? How are we able to actually control the inventory? How are you able to get a view of, the servicing that has to happen on these assets and actually automate that and really help your field service teams or your healthcare technology management teams know that they have a playbook of assets that they need to really work through. So we have the capability to do that. We're also looking at alternative equipment maintenance, right? Or the ability for, if a part goes bad, we're hooking into Part Source to really understand how do you do the replacements. We're working with Medigate for the discovery aspect of it. So connected, non-connected devices, it doesn't matter. We are extending our assets into our CMDB into clinical assets so that we can actually be the system that manages medical devices. And then, EMR as a support service. So in some instances, Epic has the capability to have Community Connect. So you offer up a view of the medical record to those people that can't necessarily afford it, or just as your affiliates. But now, once they have issues with the electronic record, how are they able to document that? How are you able to see that they might have configuration changes? So we have this notion of EMR as a support, which basically gets to a point of managing any type of maintenance associated with it or service outages as well. And then we spoke a little bit, if you remember in our previous chart, about the risk and security workflows. So we're really looking at, and we've been doing this as well, as to how do we ensure vulnerability response for healthcare organizations in their existing infrastructure? So how can we integrate your security products, actually get to a point of prioritizing workflows if there's some sort of a event or a disaster or something goes down? We had to get on the call at midnight and everybody had to stay on that call until we figured out what was the plan for business continuity. It shouldn't have to be that way in this day and age. There should be a way for us to, isolate certain incidents, automate that other systems that might be interfacing with them are on lockdown, and then get a process going so that you can remediate faster, you can post the information in a centralized location, and really not make an already stressful situation even more stressful. And then I want to talk a little bit about just some of the areas where we're looking at extending into referral management, right? Referrals. Once a referral is made from a general practitioner, my experience has been it's kind of like a black box after that. Like if the patient follows up, great. 1 in 3 patients actually have a referral made. Only 30% of those patients follow up. So those other 60% of them actually don't do anything, or they put it off, or at some other point later on in life, it becomes a critical condition that could have been handled had we closed the loop on these referrals. So now when your general practitioners are referring outside, what is that concierge service we can give the patient to say, oh, by the way, have you scheduled this appointment? Here's some time slots. These are the different locations within 30 miles of you. And so really looking at, how do we make the experience better for the patient, as well as from a practitioner standpoint, how do we close the loop? Once that referral has been made, and let's say the patient did see the PCP or the specialist, did that information get back to the general practitioner to really close out the loop? And so, these are some of the things that we're thinking about. Provider portals right now, when I talk to healthcare organizations, a lot of their providers use the employee intranet. And we all know it's hard. It shouldn't be so difficult when they have a different set of information they might be searching for. How can we create, similar to a patient 360, a provider 360? How are you able to now look at what these providers need? How can they request services? If they have certain cases that they have opened or their practice has opened, how do you make sure you prioritize those things and give them a place to go rather than, the same place where all of the employees go? And so just being able to have a little bit more specialized touch that can really help them save some time. And then again, going back to this notion of care at anywhere, really, it's not just at home. We all know that healthcare is moving outside of the walls of the hospital. How do we actually get to a point where we can support the notion of clinicians, devices, and people in different locations and really help them get to a point where they can function and extend the same quality of care that they're receiving within the four walls, but now outside of those four walls. And so streamlining the tasks and gaining the visibility, really giving the patients, how many times, I've had to wait for a hospital bed. I had no clue where it was. And so I literally had to stay at home for 24 hours because I didn't know when that person was coming to deliver the bed and I couldn't miss it. And that was like a condition of discharge. And so again, it's like, there's life happening already that's very, crucial to the way that care is being delivered. We're already put in these circumstances. And now for patients, we're making it harder. How do we actually make it simpler in terms of these different workflows? And then we're also working with another organization related to clinical pathways, right? So they saw that across their healthcare system, renal pathways were varied in terms of the quality that was delivered. It was inconsistent. So now we're working with them on the whole workflow around how do you get to a point where you can, starting with the patient journey all the way to care at home protocol, how do we make it more consistent across all of those locations? It's through, automated workflows, and not just automated, but just more intelligent workflows so that each of the facilities and the care centers is doing it similarly. And then as we think about, just supplier support services, all of the vendors that you're having to interact with, there's a poor procurement department that's sitting somewhere having to do RFPs, having to do contracts, volume-based discounts, et cetera. And then they have these vendors reaching out to them. It would be great just to have an interface, right? Similar to how you have a patient engagement portal, a supplier support portal would be great so that, your procurement team has a face rather than just emails or phone calls, but to really get to a point of, onboarding suppliers or kicking off the security requests when you're doing RFIs or RFPs, making sure you have a sense of which suppliers are not actually delivering the equipment on time. And is there a trend there? Or if you're into ESG, which one of your suppliers are actually into ESG and how many of them are actually supporting that cause? So being able to make things more manageable there as well. And I touched a little bit about the RPA capabilities. I really think that as we move forward in healthcare, a lot of these tasks can very much be automated and really, more of the specialized skilled labor should be put in front of the patients, right? That face time with the patient is very important, but we're looking at use cases across the patient care spectrum where we look at, how do we actually automate scheduling, or how do we do the claims or billing processes that we have? How are we able to actually get the devices, recalls and tracked? Once there's a recall, what happens? That could all be automated if we know that the series of tasks are there. We could build playbooks around it. And so here's some of the various use cases that we're looking at in terms of RPA. And so, here's just a couple of examples of just value that's been realized with some of our customers and our partners. You can see, at the end of the day, it's really about just making it more efficient and effective and giving either time back or value that's more than what is, initially thought about when you think about healthcare workflows. And ServiceNow is in a space where we are a horizontal, we are a, platform of platforms, and we do workflow automation. Now with our digital health platform, we're able to now take that to another step and actually get it more focused around clinical workflows, IT workflows. And one thing I just want to call out is, we are not trying to be an EMR. We want to play alongside the EMRs and make sure that if EMRs could solve for everything, we would all be in a better place in terms of healthcare efficiency and operational and outcomes. But, there's a whole ecosystem supporting it. So in that abstraction layer is where ServiceNow plays to be able to connect these various workflows. And so with that, a couple of other use cases related to just RPA, we were able to help St. Jude's in terms of their contract signing process so that, they were able to get down to 4 weeks deployment, looking at various digital signatures. And we created a custom app for them that allowed them to save some time per month in terms of closing out contracts. And then I spoke a little bit about NHS Scotland, where from the time the need was there to the time it was deployed, 6 weeks, 2.5 million members vaccinated, 1.5 million tests that were conducted on the ServiceNow platform as well. And so with that, I just want to thank you all for listening, for doing what you do. And the fact that you attended this, is helpful to say that you're trying to do something different for your healthcare organizations. We are all in this, we are in this to make healthcare better and have patient outcomes better. And we can make it happen through partnerships. And so I thank you, and I open it up for any questions that might have come up as well.
Vishakha, it's Steve here. Great presentation. We just have a question from Ben Kason, and he's asking about referrals management, provider portal, and care at home slides as to whether these are solutions we're expanding into, or it's part of our roadmap, or sort of where we are in terms of those product evolutions.
Yes, and so there's two components to the referral management. One is the physician relationship management, right? So how do you actually manage some of these physician networks, et cetera? We have a solution in that space. Referral management, I'm actively working on the demonstration for that now. We have a design partnership. And so I would say that that's going to happen likely in the next 2 months, but it is something that we are actively engaged with. The care at home, there's aspects of care at home that can happen today. We already do the field service management. We are looking at doing the devices later this year. And so managing the whole life cycle, getting them into your CMDB, documenting it, and then looking at actually the maintenance of those devices at home and in remote locations to the early part of next year. So that's kind of where we're at. But there's other aspects of care at home that I'd like to, again, we should probably have a conversation about what the specific use case is, but there's some areas that we can already cover, like actually sending clinicians to the home or patient engagement at the home. Hopefully that answers the question.
Yeah, that's it. I believe that's all the questions we've had, but great presentation. I think the feedback is outstanding. So thank you for this.
Very good. Thank you, everyone.